Hospital's Health Chat. This is a chance for you to get your questions answered about health topics that are of interest to you. Today we're going to spend about 20 minutes talking with a breast cancer and surgical specialist, and we will be talking about the genetics of breast cancer. So I'd like to welcome right now Dr. Olga Ivanoff, and you are a breast surgeon at Florida Hospital Celebration Health. And we're very happy to have you here today. And you founded the Comprehensive Breast Health Center at Celebration, didn't you?
That is correct, Barbara. Thank you for having us here.
Well, we're glad to have you here too. And I just want to remind the viewers that this is a chance for you to ask your questions, viewers to ask their questions, and you can ask them right there by filling in the box at the bottom of your screen. Again, we have about 20 minutes, and we want to talk to you about the genetics of breast cancer, particularly the BRCA1 and 2 genes. These were kind of made famous, if you will, by Angelina Jolie when she announced that she had had a double mastectomy because she was at high risk for breast cancer. Did you see a lot of people coming to you after that, after they heard her story?
Very much so. In the aftermath, a lot of women, I think, overestimated actually their real risk. I think first things first is realizing that only 0.3% of average population do have this gene, mutation of this gene rather, and vast majority is not affected by this gene. However, women who do have this mutation do have a high risk of developing breast and or ovarian cancer, up to 87% chance of developing breast cancer, about 40% chance of developing breast cancer on both sides, and about 40% chance of developing cancer of the ovaries.
And in Angelina Jolie's case, I guess one of the signals to her was that her mother developed breast cancer at a young age and died when she was in her 50s. And so Angelina Jolie finds out that she has this mutation, and her decision was to have a double mastectomy. So what did she go through? What kind of treatment did she have?
Well, first she had the test that determined that she is at risk, that she actually has the mutation. And following that, she underwent a prophylactic mastectomy, meaning prophylaxing the cancer before the cancer has been discovered or set in. And she chose to undergo mastectomy with nipple sparing, which majority of the time we can afford the patient to do that, saving the nipple, saving the skin envelope of the breast, removing entirely the breast tissue. And most of the time we reconstruct in 2 stages, although 1-stage reconstruction is offered as well. First stage being right at the time of the surgery to remove the tissue, the breast tissue. We'll place an expander under the major muscle that covers the chest wall and slowly expand that muscle out over weeks to months, depending on how a woman can tolerate the discomfort of the expansion. And then there's a second procedure that's usually an outpatient fast procedure that's required to swap out the expanded expander for the permanent implant.
Is this a very uncomfortable procedure to have?
It's all a relative term. There's very good pain medication that is available, especially to prevent muscle spasms. That's where majority of discomfort comes. It's actually not incisional pain or pain from actual cut, but it is just the stretching of the muscle. If you can imagine, you pull a muscle, that's what typically is giving the most discomfort. So controlling that muscle spasm is really what we're finding out what controls the overall discomfort of the patient. And everybody is very different, and some women who have certain expectations probably do have more discomfort, and some women who know what to expect and prepare themselves physically and mentally, I think, have less discomfort.
But as we see in her case, the result can be very lovely. I mean, you can protect yourself by having both breasts removed, if you need this, of course, and then having the reconstruction and get a very lovely lifelong result.
Lifelong result. The key, again, to realize is that, yes, a woman can start with an 87% chance of developing breast cancer. We do reduce it down. We don't reduce it down to 0. We reduce it down to about 5%. So even after removing the breast tissue, there are no guarantees. There's still about 5% chance that a woman can still develop breast cancer. And that is because when we remove the tissue, we still, no matter how hard we try, we have to leave some normal breast cells behind, and those breast cells can potentially start a new breast cancer. So we do reduce dramatically the risk of developing breast cancer. However, it's never down to zero. And we are, I think, as surgeons and plastic surgeons, victim of our own success as the implants become much greater and better and have more natural shape and feel to them. The reconstruction many times affords, I think, a better outcome cosmetically than a woman had before.
Wow.
Yeah.
That's encouraging, though. I mean,
Very encouraging.
if you're faced with what appears to be almost a certain death sentence,
Right.
to be able then to have this option and come out with a lovely result is really very wonderful, too. Let's talk about the genes themselves. What are these genes?
So we all carry these genes, and these are important genes, and they stand for BRCA1 and 2, called breast cancer associated gene 1 and 2. We've so far only discovered 2 genes. Who knows, maybe there's more. And these genes typically police the body and survey the body to make sure that there's no cancer developing, and they're suppressing the new developing cancer. However, when they are mutated, they're not as good at suppressing the cancer, and so the cancer can replicate with impunity. These genes, of all the women who come in already to see me with breast cancer, 15% of those women with breast cancer would have a mutation. So general population would have 0.3% chance of this mutation. Women who already have developed breast cancer, but 15% of those women have BRCA genes mutated and responsible for that cancer.
So if a woman comes into you already with breast cancer, is this one of the things then that you'll early on test for to see, do you have this gene? Let's find out.
Only if there's enough red flags in her history. If it's an 87-year-old great-grandmother who has isolated breast cancer, obviously I'm not going to test her because it's very unlikely that this is because of genetic mutation. But if it's a 33-year-old whose mom passed away at 35 with breast cancer, and who has a sister at 40 with breast cancer, and who has a particularly aggressive type of breast cancer, such as triple negative or estrogen negative cancer, those are red flags for me to say, yes, there's a very high likelihood that this woman could have genetic component to her breast cancer. So every breast surgeon should, when a woman comes to her, kind of have this questionnaire or questions asked for the woman. How old is she? If this is a cancer on both sides, family history, male family history. So a woman could have a father with breast cancer or an uncle. Those are huge red flags for us to start thinking, could this be more of a genetic makeup to the cancer rather than what we call sporadic or by chance cancer?
So you said a woman could have a father or uncle who is passing this on too. So
Absolutely.
the genes can come down either through the mother or the father.
Yes, there's 50-50 chance of developing it, of inheriting it, is either from maternal line or paternal line.
And it's really kind of silent if it's coming in through the paternal line too, because so few men develop breast cancer. Only about 1% of men, or 1% of cases,
Right.
are men who have breast cancer.
Absolutely. But those are big red flags. So I think every male who develops breast cancer should absolutely be tested for it. And important point is when a woman talks about her family history, not only should she talk about her mom and mom's sisters, but dad's sisters, kids, cousins. So because both sides of the family are as important here.
What are some of the other risk factors? There's a certain population also that is very high
Right.
risk.
So people of Eastern European Jewish descent, also known as Ashkenazi Jews, such as Poland, Russia, Ukraine, Belarus, they have a higher chance of developing or of being victims of this mutation, BRCA1 and 2 mutation.
Overall, this is still a small portion of
Correct.
the breast cancer population, if you will. What are some of the general signs and signals that women need to look for? We're heading into Pink October shortly,
Right.
Breast Cancer Awareness Month.
Right.
This is a time when women traditionally do pay more attention, but they really should be paying attention year-round, right?
Year-round, all 12
Yeah.
months a year, not just 1 month a year. Well, first and foremost, realizing that as soon as a woman hits age 40 and she has really no high risks, no family history, she's still at the age of 40 and yearly thereafter, as long as she's active and in good health, she should be getting yearly mammograms. That's first and foremost. And realizing that the best time to develop, to screen and to make sure that we catch breast cancer is before the symptoms are produced. So before there is a lump that a woman can feel, or before there is loss of symmetry between the two breasts, or before there is nipple discharge or skin puckering, all of those signs indicate to us mostly that the cancer is a little bit more advanced. Best time for us to catch it and cure it is when it's found on the screening mammogram before it has had a chance to produce any of those symptoms.
So you want to catch it early on,
Yes.
and mammography is really
Is
the
the key.
gold standard to
Yep.
being able to identify it very early on. We do have a viewer question right now, and that is, at what age should women get the BRCA test if they think they have a history for this?
Not until their early 30s, we think. Because in the 20s, even though the risk is there, it's not significant, and a woman has to undergo really good genetic counseling prior to even her getting the test to make sure she understands what the implications are. Because if she is affected, then we would want her to actually undergo, complete her childbearing, complete her breastfeeding, and at that point we would either put her on chemoprophylaxis, which is a fancy word for saying take a pill to decrease the chance by 50%, or do the surgery by removing breast and or ovarian tissue to decrease the chance by 95%.
When you say chemotherapeutics,
Chemoprophylaxis, yes.
Chemoprophylaxis, taking the pill to
Yes.
lower your risk. Are there side effects to that, though?
Of course.
Is that very a difficult pill to be taking?
There's side effects to everything,
Yeah.
even taking a benign aspirin. But so there are a number of medications. The most common one used in Europe and in the United States is something called tamoxifen. It's actually a pill most women would know from. It's part of treating breast cancer that is estrogen positive. So this medication has shown to decrease the risk of developing breast cancer by half in many women at risk. And most side effects involve menopausal symptoms, hot flashes. Very, very rare but real side effect is actually developing uterine cancer. So that scares a lot of women trying to take a pill to prevent one cancer just in order to put themselves at a slightly increased risk for developing another cancer.
Yeah, and this is reminding me too that you said the ovarian cancer risk is increased too with
Right.
these gene mutations. So how often do women go the whole distance and they have the double mastectomy and then they also have their ovaries removed?
Most women who find out that they are at risk and who, as I said, in their life history or lifespan where they are done having kids, where they are done having breastfeeding, do choose to undergo a surgical approach.
There's so much to think about here. I would imagine when a woman gets this diagnosis, it hits her just like smack in the face. And what kind of counseling do you offer? What kind of assistance to help the woman be able to kind of work her way through this minefield now that she's facing of what are my choices? What about having more children? What about
Right.
remaining fertile? What about all of these questions that come up?
Well, even though it sounds scary, but for a lot of women, it's actually a huge sigh of relief knowing that they are at risk. Because usually these are the women who've seen their moms pass away, or sisters, or aunts. So they've hands-on seen this tragedy in their family. So now they actually feel empowered that I can avoid that fate of my mom or sister or aunt that I've seen time and time again. So now I can actually do something about it by either doing prophylaxis with a pill or doing heightened surveillance, or most of the time ending up doing surgical approach. So, but still, however, you're absolutely right, it's a hard pill to swallow. And we do have genetic counselors who counsel the whole family, not just the affected woman. And we also provide psychiatrists and psychiatric help for women to talk it through, talk it out.
So you have a full battery of
Absolutely.
professionals to assist you too. Another viewer has just asked us, how difficult is this test to find out if you do have the BRCA1 or 2 gene mutation?
It's as simple as actually spitting in the cup, literally, because it can be done either on the cheek cells that we collect with the saliva, or on the blood work, and both routes of getting the DNA are equivalent. So whether we do blood or we do saliva with the cheek cells is the same equivalence.
And how long does it take to get the results of that test then?
Well, that's a tricky one. The actual test is about 5 to 10 business days, provided that the insurance will pay for it, because not all insurances right now are on par for paying for the test. It is about $3,000. So once insurance gives us a green light, or gives the patient the green light, it takes about only 7 to 10 days.
I can't imagine that insurances aren't going to pay for something like that when a patient has these kinds of risk factors too, but that is a whole other story and another
Whole other
topic.
story,
Yeah. So let's talk about Pink October is coming up.
Yes.
There's a lot of enthusiasm to
Yes.
participate and to help out in the fight against breast cancer, whether you have it or friends or other associates do, or you just want to pitch in and help out. And I know you have a special project that you're excited about too. Tell us about that.
Well, the community of Celebration, the town of Celebration, the beautiful Disney concept, and the hospital, the Celebration Hospital, are coming together to raise funds through a lovely walk. It's a 3-mile leisurely walk, and we invite everybody to participate, women and all the men in their lives, and their pets, leashed, to walk together next Sunday, a week from this Sunday, September 29th. And all the 100% of proceeds will go and stay actually at the Celebration Hospital Breast Center to provide support for the women through lymphatic massage, through nutritional counseling, exercise physiology. So all of these things that elevate breast cancer treatment to the next level, and providing women comfort and healing and holistic approach to their journey through cancer treatment.
Yeah, and I mean, these aren't just ancillary treatments too. Lymphatic massage can help them prevent
lymphedema,
which is a very painful swelling of the arm that can happen as a result of having breast cancer and the surgery that's involved in that too. So that massage is important, and then nutrition counseling, of course, is important too, while you're undergoing your breast cancer treatments and such. So this sounds like an exciting walk. What time does it start, and how do people enroll?
Registration starts at 7:30. The walk itself is at 9 a.m. after a short kickoff, and people can go on pinkonparade.com website, register their friends, and they can still create teams, and it's a fundraising competition, and get their t-shirt and come and join us.
So the idea is to ask people to sponsor you for the walk, and bring more and more people into the teams. Is there a minimum fee to just be part of the walk yourself?
$35.
Okay, so that's the starting point.
Yes.
And the more you can raise individually, the better off it is,
Yes.
and all of this will be helping patients, breast cancer patients at Celebration Health.
Correct.
That is great. Well, I wish you very much luck. Is this the first year with that program?
This is the inaugural year, and the plan is to have it every year at the end of September.
Do you have any idea how many people from Celebration Village are also involved in all of this and getting ready to participate?
There's a great number of interest, and people want to, anonymous donors come out and want to donate and match, and our goal is 22,000, and if we go up to 10, we will be matched 10,000 by a donor. So there's a lot of interest, and the community has really embraced it.
Well, we wish you much, much success with that. Dr. Ivanoff, thank you so much for joining us. And I just want to let people know that they can contact you also directly if they're interested in seeing Dr. Ivanoff and talking with her further about this or about breast cancer in general. Let me just tell you how you can get in touch with her. She is at 407-303-4760, and you can also visit her online by going to www.floridabreasthealthspecialists.com. If you want to participate further in further health chats, then join us again next month. We invite you to send us your topics that you're interested in as well, and we look forward to hearing from you. So you have a wonderful month and a wonderful day, and join Dr. Ivanov's walk. Good day.